Hello, my name is David O'Regan. I'm a consultant cardiac surgeon in Leeds. I'd like to introduce you to a simple philosophy in surgery that I adopted in 2009 when I was challenged by a trainee during the closure of her chest for using bone wax. Bone wax is usually applied by surgeons to the sternal edges to reduce bleeding during an operation. And this trainee pointed out to me in no uncertain terms that we were effectively introducing a foreign body into the wound. We then sat down together to look at what we're doing and the fundamentals of making an incision and opening the sternum and closing it, and wondered if there was any evidence for any other interventions that could optimize tissue healing. And in doing so, we came up with a tissue care bundle in 2009 that I've applied to my service ever since. And I'm delighted to report that I've only had one sternal wound problem in 1,400 cases. Now, I'm not talking about infection or whether it was culture positive and culture negative, because I think if we're going to talk about wound infections, we should look at any wound problem that causes the patient distress or requires any intervention whatsoever. And that is why I've included in my data all sternal wound problems. So what is the bundle? First of all, I use knife only all the way to the sternum. Traditionally, many of us use electrocautery and burn all the tissues to the sternum. I then use electrocautery very judiciously with pinpoint hemostasis. I no longer use bone wax to the sternum, and I introduce a thrombin gelatin over the sternal edges. Now, the thrombin gelatin, I believe, actually will kickstart bone healing. I then actively keep the patient warm above 34.5 degrees. And it's interesting that surgical site infection bundles have introduced warming blankets as a compulsory for all post-op periods, with the exception of cardiac surgery, because traditionally we have always used hypothermia as part of our armamentarium to protect the organs. But with modern bypass, this has become very safe, and therefore I've actually set a temperature of minimum 34.5 during the perioperative period and actively rewarm. I then close the sternum in the usual way, but introduce the collagen gentamicin impregnated fleece in at-risk patients, that is diabetes, elderly, or steroids. And in closing the deep tissues, if there's more than 3 centimeters of fat between the sternum and the skin, I leave a ReadyVac in situ for 72 hours. Now, the results speak for themselves. Whether it's me opening or closing, or my trainee opening and closing, or a mixture of either, no matter the increase in complexity of patients we've seen since 2009 with age and diabetes and obesity, the wound infection problems have reduced to 0. All we have done is actually employ basic tissue handling skills. Respect the tissue, and the tissue looks after you. And I reflect on Lloyd Monahan's comment. His bust adorns the stairs at the top of the staircase in the old Leeds Journal and Infirmary. And he talked about hands being soft and caressing tissue rather than being a hewer of flesh. Again, I wonder how many surgeons have actually stepped back and thought, stick to the basics, keep it simple, and perhaps we can remove wound problems altogether. And this is going to be very important as we're seeing the advent of antibiotic-resistant bacteria. Just a thought. Thank you.